Today, we are so honored to have a true force and change maker in the field of medicine, public health, and especially young-onset colorectal cancer with us. She is the Associate Chief of the Division of Gastrointestinal Oncology at Dana-Farber Cancer Institute. She is an Associate Professor of Medicine at Harvard Medical School in Boston, Massachusetts, and most notably, from my perspective, even alongside all of her training at Yale, at Penn, at UCSF, at Harvard, she serves as the founding director of the Young-Onset Colorectal Cancer Center, one of the first of its kind in the country. And having been a young onset rectal cancer patient myself, I only wish I would have had the care and central force that Dana-Farber has provided in the lives of so many, and dream of the day that people like me will have this as a standard of care no matter where they are. So thank you so much for your work and for saying yes to me when you've shown up on the Today Show, on ABC News, on the New York Times, on CNN, the Washington Post, and with us here today, I want to welcome the wonderful Dr. Kimmie Ng. Thank you so much for being here.
Thank you for that nice introduction, and it's really my pleasure and honor to be here.
So let's jump in. This is your life. This was your choice to go into this space. And I'm curious about why you decided to found the Young-Onset Colorectal Cancer Center at Dana-Farber.
Well, I have known for a very long time, just to start at the beginning, that I wanted to be an oncologist. I first became interested in cancer through the laboratory, actually, where I worked, and became fascinated with the molecular mechanisms of malignancy. But then when I went into medical school and actually had the opportunity to care for patients with cancer, that's when I knew my true calling was really to help patients going through this incredibly difficult time in their lives. And I chose gastrointestinal cancers because the prognosis for so many of them was so dismal, and there was just so much work to be done. So I became a gastrointestinal medical oncologist and then started seeing patients in clinic. And then in recent years, my colleagues and I just started noticing, wow, there were all these really young people showing up in our clinics diagnosed with very advanced stages of colorectal cancer, and with seemingly no risk factors, no family history of the disease, no genetic syndrome that could account for why this was happening so young. And often they were really quite healthy and didn't have any of the typical diet and lifestyle factors. And I realized all the unique challenges that young patients also face when they get hit with a diagnosis like this at this particular stage in their lives. And so I was really motivated to try and take better care of these patients, but also to really rally a multidisciplinary research effort to better understand why this was happening in the first place.
So why do we think that is? I know there are all kinds of different hypotheses at this point with extensive research underway, but there are a wide spectrum of different hypotheses that are hitting headlines and certainly hitting people on the front line that might receive a diagnosis like I did. What's your take right now?
Yeah, so that is the question of the century, right? It is the big mystery that we are all trying to solve. We do know that when you are diagnosed at a younger age, there is a higher chance of finding a genetic syndrome or having a family history of the disease. But the vast majority of young patients who are diagnosed do not have those things. And we very much believe that it is something that's likely in the environment or some combination of factors in the environment that's likely accounting for why this is rising in recent years. When we look at the trends, we notice what we call a birth cohort effect. And that's when the increase really happens and travels by generation. And when we see a pattern like that, it usually does indicate that some recent environmental exposure is likely contributing to why the trends are increasing.
So what are some of the hypotheses out there that you're seeing? I know you, among all of your talents, leading research in a range of places from the microbiome all the way through to genetic predispositioning, so on and so forth. There are a range of hypotheses. Are there any right now that's even worth talking about that are mid-research cycles for us to understand more definitively what's going on?
Yeah, it's a great question. And to date, the published literature has really focused on risk factors that we already know are associated with colorectal cancer overall. And a lot of us have focused on the risk factors that have seemingly increased alongside the increase in young onset colorectal cancer, with obesity, being the popular, most looked at hypothesis. And indeed, in a lot of studies that we have looked at, we do see an association between obesity and a higher risk of developing colorectal cancer prior to the age of 50. We've also looked at things like sedentary lifestyles. We've looked at intake of sugar sweetened beverages, low vitamin D levels, and all of these things, yes, are significantly associated with young onset colorectal cancer. But I have so many patients who don't have any of those risk factors. So it's likely a combination of these things or perhaps something entirely new. There are many different chemicals in our foods now and in the environment, and our diets are not what they used to be. And so it could be any one of these lifestyle or environmental factors that could be doing it. And all of these are under investigation right now.
Do you see a similar rise in exposure in different countries? There's a different standard in terms of what people are eating and what's normal in terms of their access. Do you see these types of patterns happening in other demographics and other locations? What are you seeing from that perspective?
Great question. And yes, unfortunately, this is a global phenomenon. What's interesting
Mm.
is that the steepest rates of rise seem to be occurring in countries that are characterized by more westernized lifestyles and higher socioeconomic status. And what that may suggest about what the potential underlying causes are is still unknown, but certainly, may provide some clues as to what factors we should be investigating. But what's frightening is that we are actually seeing increases in other parts of the world right now that may not have these higher socioeconomic status attributes, are not characterized by a westernized lifestyle. So, for example, we are starting to see increases in even sub Saharan Africa or in East Asia, where diets are very different than what we see in the United States. So, this is very much a global phenomenon. It's happening in both men and women. It's happening in almost every state where we have data in the United States. And it is happening in every race and ethnicity for which we have data as well. So, again, really a global problem that needs some answers very soon.
I couldn't agree with you more on that one. Having had three children and at point of diagnosis, I was 39. I was 16 months after delivery of our third little boy. Some of the symptoms that I was experiencing were also similar to that of post childbirth, what I'll call norms. And I don't think there's anything normal about excessive bleeding from your backside or urgency to go to the bathroom or blood in your stool or even just the levels of anemia that I was experiencing at the point of diagnosis. What are you seeing as it relates to young mothers? I've heard other hypotheses of people who have had babies after 35 that might increase their incidence toward colorectal cancers. There are a lot of myths out there, likely some that need to be debunked. But I'm curious from your perspective if you're seeing any anomalies around moms in particular.
Yeah, I think there are definitely association studies that show a link between older age at childbirth and increased risk of breast cancer, for example. I don't think the studies are as consistent with regards to young onset colorectal cancer. But I think what you bring up is so important, and that's the challenge of timely identification and diagnosis of this disease in young people, right? Because there is still such a lack of awareness that colorectal cancer can happen in a young and otherwise healthy person, including a young mother. And there is still such a lack of awareness, even among many healthcare professionals, that this is a disease that can happen in young people. And as a result, because many of the symptoms that often are present at the time of a colorectal cancer diagnosis are so nonspecific, things like blood in the stool or abdominal pain can be due to many other things that are arguably a lot more common in a young person. This leads to huge delays in arriving at the correct diagnosis of colorectal cancer. And what that has led to is, unfortunately, we are seeing young patients being diagnosed with much more advanced stages of colorectal cancer than if they were caught either when they were asymptomatic or early on, or if they were being screened. And that may be why we sometimes see worse survival among young patients compared to older patients.
So, how do we help our frontline physicians understand that the face of colorectal cancer has changed? Not even is changing, it has changed. How do we get access to that information for the people who might be hearing our OBs, our internists, our annual physical checkups, our general practice, family practice doctors? If you had that magic wand, what would your wish be on those front lines?
Yes, I think it's just going to take massive education and a broad awareness campaign, honestly. And we at our Young-Onset Colorectal Cancer Center have this as part of our mission. We have
Mm.
started a quarterly webinar series that's aimed at healthcare professionals who may be encountering these patients early on, to hopefully help educate them about the statistics around young-onset colorectal cancer, how it typically presents, what age ranges are most likely to be affected, and when symptoms should be red flag symptoms for a deeper workup. Podcasts like this also help a lot in raising awareness among not just the general population, but also among the healthcare community. And also speaking at continuing medical education conferences, which I've also done and made a priority to do, just so we can reach those family physicians and urgent care doctors and emergency room doctors. Those who are most likely encountering these patients when they first get symptoms will be really important. That, and I think just more publications and articles and research studies about this being put out there in journals that these practitioners often read will also help to increase awareness and education.
Yeah, there's so much work to be done. So much work to be done. And I'll get questions from my little boys in the back seat. We just turned 11 this week for my oldest, and the ages range all the way down to 4. I've shared very openly with them from the day of diagnosis throughout treatment. I'm now just over 2 years on the other side of my treatment ending. But I'll get questions from the back seat about, could your cancer come back, mommy? What can happen here? And I often tell them, God picked me to have rectal cancer because he knows I have a big mouth, and I'm going to be out talking about butt cancer all the time. And so, if my time comes early, I won't be going quietly. And, these kinds of tough questions, just as we're driving around, come up. There is a difference to this colorectal cancer, not only diagnosis, but going through treatment and life on the other side, that is very unique for younger people. I'm curious what you are seeing, ranging from fertility, from partnership, from communicating with young children, from the lifestyle as a working parent, that the center that you founded helps support in a nuanced way, because not everyone can come to the center or even knows about it. I'm curious what some of those top line messages are that you have for people that might be at the beginning of their journey or with friends that are facing it as well.
This is such an important topic to talk about. And also, I want to just say congratulations for being almost 2 years out from
Thank
your
you.
treatment. That's absolutely wonderful news. But it's exactly as you said, young people faced with a diagnosis of colorectal cancer have very different challenges and issues and concerns than somebody who may be in their 60s or 70s. And I think as my colleagues and I were seeing more and more of these young patients in clinic, and also seeing patients who come from elsewhere here for a second opinion, we were noticing that a lot of the really critical issues that young patients face were actually not being addressed. And, some part of that is understandable. We're very worried about getting them started on treatment quickly, getting that port in,
Mm-hmm.
taking care of all the medical aspects. but equally important things like fertility concerns and preserving that fertility before starting treatment, addressing the financial disruptions and career disruptions that happen at this stage of life, and also the parenting challenges that come with having to undergo a cancer diagnosis and treatment while having young children. A lot of these things were not being addressed. And so that was a motivation for us to start this Young Onset Colorectal Cancer Center. We conducted focus groups of patients as well as their caregivers to really ask them what were the challenges that they faced at diagnosis, what resources did they wish they had in place when they were diagnosed. And we used what we found from those focus groups to really design the sources of support that we would include as critical components of our center. So one was patient navigation. A lot of people in
Mm.
their 20s and 30s are previously completely healthy. They may not have a primary care doctor. They may not have had previous experience with the medical system at all. And so we felt that having a patient navigator was really important to helping guide them through the initial steps of diagnosis and treatment planning, and then as they entered survivorship. We also knew from survey studies that were done that 80% of our young onset colorectal cancer patients have children under the age of 18 when they're
Hmm.
diagnosed. Many are also taking care of their elderly parents, right? This is the sandwich generation that's being affected by this diagnosis. And so there is a lot of psychosocial distress around a diagnosis like this at this stage of life. So we have a dedicated social worker who actually has experience and expertise in young patients with cancer, who is solely seeing our patients in our center. We have web-based virtual support groups that are available to anybody. You don't have to be a patient at Dana-Farber to participate, because we
Oh,
recognize,
wow.
yeah, we recognize that a lot of centers, either academic or community, may not have this focus group only of young onset colorectal cancer patients. So we a support group, sorry. So we wanted to make that available to everybody and not have them have to be part of Dana-Farber to participate. And along the same lines, we have a lot of educational webinars, seminars. We have an annual patient and family forum that's again open to any young patient with colorectal cancer and their supporters and caregivers. Again, trying to extend our reach beyond just the walls of our cancer center to help all patients out there who may be struggling.
Well, and it's so true. The integration of all of these aspects of life are challenging without a cancer diagnosis and life on the line, right? The mental capacity, even if we just look at recent years of going through a pandemic, juggling a modern family, potentially working from different locations with schooling in the home and then back out of the home, to then face a diagnosis like this to get through. There's so many different spokes off of this wheel that are so integral to a healthy outcome and quality of life on the other side. Sometimes people gloss over different ways of treating this, be it from the mental health support. I had a near death experience in the delivery of our third son, and I look back in hindsight saying, oh my gosh, that happened. My rationale, being a silver lining type of person, was that I had an amazing mental health team around me. With having a PTSD diagnosis after that delivery, that wasn't something I had to search for 16 months later at my diagnosis day. And I was just beginning to wean off of the cadence that my therapist and I were meeting. And lo and behold, I got the diagnosis, and we met 3 times that week, let alone shifting to every other month. What type of resistance do you see from people, be it the patient themselves and or their caregivers, to lean into that type of more emotionally supportive medicine that's a key part of how we treat cancer in young people?
I think it's just as you said, it's under recognized and underappreciated. And I think a lot of oncologists are used to taking care of older patients with colorectal cancer, where this may not be as prominent an issue for some. Of course, it's challenging to get a cancer diagnosis no matter what age you are. But for all the reasons that we just talked about at this stage in life, there are high levels of psychosocial distress. We also know, particularly in some cultures, that there is a stigma around admitting that there are mental health or emotional challenges associated with this. And seeking psychosocial support is also associated with a stigma. So at our Young Onset Colorectal Cancer Center, we really wanted to remove that from the equation altogether. And so at every visit, at the very first visit that a young patient has here in our center, they are met with our program navigator, who administers a kind of universal, what we call a psychosocial distress screen, to assess, what the level of distress is associated with this very horrible diagnosis. And if somebody screens in, they automatically get a call from our social worker. And it just normalizes that as part of the care of a young onset colorectal cancer patient. And as a result, I think many more young patients are receiving that psychosocial support that's so important, because we've kind of normalized it as part of the routine care of our young patients.
Well, I think more people talking about getting this type of support, it'd be like if we broke our ankle and just didn't go get an x-ray or a cast on it, right? The power of our mindset and what that does to not only our body, but to our community and those that are around us closely is so powerful. And if we can give that good boost and that support to it, oh my gosh, how much better will we be, not only going through these tough experiences, but also on the other side of it. I think looking at quality of life is so hard when you're just fighting for your life. How have you seen that show up in terms of things that people can be doing throughout their treatment that will impact that quality of life on the other side? I cut you off too. I felt you had an insight there too that might have struck you. So please feel free to roll back if you'd like to, Kimmie.
Yeah, no, I was just going to talk about that stigma that you mentioned, because it goes beyond just seeking psychosocial care, right? It goes to the lack of awareness too. People don't talk about their colorectal cancer diagnosis. They don't talk about their bowels. They don't talk about blood in their stool. And so that really hinders early detection and just being aware that this is happening in young people. And so I think podcasts like this, interviews about this, articles about young onset colorectal cancer can help hopefully to normalize the conversation around some of these difficult and perhaps embarrassing things to talk about, and hopefully, more broadly educate the public that this is rising in young people. But to go back to your question about quality of life, it is so, so important. And it is so important no matter what stage of colorectal cancer you have, right? If you are a stage 1, 2, or 3 patient and you are fortunate to be a long-term survivor, some of the effects of treatment, either the surgery, the radiation, or the chemotherapy, can be lifelong. And so taking care of that quality of life and addressing some of those long-term side effects that may happen from treatment is so important to ensuring that there is a long quality of life far out into survivorship. For a metastatic patient who's actively undergoing treatment, that quality of life is so important as well, because you want them to be able to still enjoy their family, to be able to work if that's what they want to do. And you don't want them to be sick from the treatment that you are giving them. And so balancing that is a team effort. And this is why we employ a village of caregivers to help us care for our young patients with colorectal cancer. And this may include having help from our pain and palliative care specialists, having help from our experts in complementary therapies, right? Like exercise or nutrition or acupuncture, to ensure that some of the side effects that come along with treatment or the cancer itself can be managed as best as possible.
Let's talk about some of those other modalities that join this village of people helping the person get to that survivorship place. You talk about exercise, nutrition, acupuncture. I was a beneficiary of Reiki, both in treatment, in the hospital setting, as well as at home, and saw extremely positive effects of that as well. What are some of these other modalities that you're seeing people augment with alongside chemo, radiation, surgeries, so on and so forth? And maybe if there are some examples of unique ones that you saw kind of play out for people, of course, name is reserved. I'd love to hear from your experience of what you've seen really help people that they may not think about at the very beginning of treatment.
Yeah, there's a huge interest among patients, and it's not just young patients, but I think so many patients with any type of cancer, no matter what age they are, in diet and lifestyle factors that may help their outcome. And I think a lot of that is because this is something they may be able to take upon themselves to control and change in their own lives, whereas so much else of the cancer experience is so unpredictable and out of their control. But we also believe there is a genuine potential role and benefit of diet and lifestyle factors in helping improve patient outcomes and maybe even improving side effects from cancer treatment. And that is one of the major research areas of our group here at Dana-Farber, where we've really done rigorous epidemiologic studies looking at the role of various diet and lifestyle factors in decreasing the risk of a cancer recurrence, as well as helping people live longer with their cancer. And there are a few things that come out with pretty good data to support them. One is physical activity. The more exercise and the more physically active you are, it seems the lower your risk of having a cancer recurrence and the longer you may live. And it doesn't even have to be a huge amount of physical activity. It's probably something like 30 minutes a day for at least 5 days out of 7 days of the week, something that gets the heart rate up a little bit. So that probably has the most scientific data to support it. We also know that following a prudent pattern diet, which is a diet that's less in processed foods and less in red meat and focusing more on fruits and vegetables and healthy proteins, also seems to be beneficial and protective. And then my own personal area of research is on vitamin D, where there have been huge rising rates of vitamin D deficiency in recent decades that seems to have paralleled this rise in young-onset colorectal cancer. And it does seem like epidemiologic studies show that higher vitamin D levels may be protective as well. Then there are lots of data on things like acupuncture, right, which may actually have benefit for things like neuropathy that comes with some of the chemotherapies we give to our patients, may help with nausea and some of the other symptoms that come with cancer treatment. And then, you do have to be careful sometimes. There are a lot of different herbs and supplements that are being touted on a lot of these social media platforms and forums where there actually isn't as much strong, rigorous data supporting their benefit. And some of them may interfere with the effects of chemotherapy and radiation. So this is where I urge patients to really talk to their oncologist about what they're interested in potentially taking before they start, just to make sure that it would be okay with the treatment that they're on.
And it would make sense to probably follow up on that after, right? For those of us that are on the other side of aggressive treatment, we're still meeting with our oncologists regularly. So talking about some of those supplements or plans or adjustments to routine, like I sing the praises of Metamucil in life. I had no idea how helpful it can be navigating both directions. If you're going too much or not enough, it's like a dream for me. But you got to talk to your doctors about it if you're going to have this type of support. So there's lots of great access to information, but really knowing what's tested and proven versus what might be suggested. One thing for me throughout not only life, but especially through treatment was the power of music in life. And it helped me to get out, frustrations, times where I was feeling angry and down and frustrated, and times when I needed to be hyped up. On our drives we live in Los Angeles, my husband and I, and driving into UCLA for treatment, we rocked out in the car and had particular playlists. Most of the time we were singing to it at the same time. I'm curious, I have two questions around this. One, are you seeing a link to people using medicine? And music therapy is one modality, but are you seeing that show up in the clinic? And not that old people at later stages of life might not need music as well. We all need music, but especially for folks earlier receiving terminal diagnosis, how do you see music relate for them?
I think music is so important. And, I started out training to be at a conservatory to be a classical pianist, actually. So I greatly value the therapeutic benefits of music. And I know there is a strong literature around the therapeutic benefits of music during acute medical illnesses. I think there were studies that looked at music for ICU patients, for example, and it seemed to improve some of the vital signs and overall, health of a lot of very sick patients. What I encourage my patients to do is to find any outlet that they've historically turned to in tough times, and absolutely that will help them get through the treatment as well. So a lot of my patients journal, and write out their thoughts, and that's a way and an outlet of coping with what they're going through. There's so many different ways, and I think part of what we're trying to do, we have a quarterly newsletter that features a young patient going through treatment or who has been diagnosed with young onset colorectal cancer, and we do ask them what helped you through your treatment. And so if somebody doesn't already have a tool that they can use or that they know will help them, they can get ideas from other young patients who are going through the same thing.
Yeah, it can be so inspiring. All
Mhm.
right. Now that you dropped the piano news, though, I gotta ask. So, did you start playing traditionally at a young age, all the way up through? And concert pianist, that's no joke. Talk about rigorous. I'd be curious to understand: is it as rigorous as going through medical school? Is my first question.
So honestly, you will find a lot of doctors who actually trained really rigorously in some musical discipline, because I do think what is required to become a performer is also beneficial to getting you through your medical studies, right? So I started learning piano age 6 and very quickly fell in love with it and was very serious about pursuing it as a career. I grew up in New Jersey, and so I actually enrolled in the pre-college division of the Juilliard School, where it required tons of preparation, tons of practice every day, multiple trips into New York City for lessons, and performances, and was really on that path. But ultimately, I found that having to impose the stresses of a career on my love of music would maybe take away some of that enjoyment. And as I went through my high school science classes, really started to become interested in science. And so ultimately decided to keep it as a pastime. But certainly all the discipline that was involved in doing that as a young child definitely helped me get through the training I needed to become an oncologist.
There's a level of detail in learning an instrument, and I even think for athletes as well. There's a level of detail and scrutiny. I was going to say perfectionism, but I don't know if that's the right word, around how you hone your craft. So I can totally see the linkage with that there. And I think it's a really strong foundation as well for people to go on to do something different outside of that creative space professionally, but certainly lessons that we learn that get applied in so many places. For you, are you still playing?
I wish I had more time to play, but actually, my children, I have two daughters, age 15 and 12, and they both play musical instruments. One plays piano, the other plays cello and piano. And I've had the pleasure to be able to accompany them in their pieces and some performances. And so I get my music that way. But certainly, once they're a little older and perhaps need me a little bit less, I definitely hope to get back into more serious playing. I do miss it.
How cool that it's been a connection point with your girls in that fashion. All right, so what's your favorite song? What are you jamming out to right now?
Well, my house is Taylor Swift all the time right now because my girls are absolute Swifties. And so that is all that is played right now. So I can't say I listen to much else except Taylor Swift currently.
I like it. I like it. It's wild. I feel like she's at the level of like Elvis for the modern
For
day. If you're
sure.
not even into the music, you gotta have that experience. So just to kind of tie up our time here, I am curious of what one hope or dream is that you have given the work that you're doing, the family that you're raising, the change that you are making in terms of standard of care for people that are at a very different stage of life. Like, what's that hope and dream that you would like to see fulfilled?
As it relates to what I'm doing in the oncology world, I have often said that this is the one question that honestly keeps me up at night. Why is colorectal cancer happening more and more in young people? And it is really my mission to try and understand why. And, we may not ultimately find one answer. It may be a combination of different things, but if we can identify what that is and somehow turn that into some early detection or prevention or screening strategy, or find something unique about a young patient and treat them with something tailored to the fact that, they were young and got this cancer super young, that would be just so amazing to be able to see these incidence curves reverse and to really change what is happening.
I'm with you all the way in that. I think there's so many points and power and where we can help people apply it before the research and the root cause definitively is known. And it's why I'm trying to share this message, at least in whatever small way I can, for people to go and be seen and to follow standards and screening protocols as well. So I'm so grateful for someone like you and the dedication and work that you have on a continual basis to fighting against this and trying to help solve it for people like me on the other side. It's tremendously important work and underfunded and understood. And so thank you for your dedication and perseverance.
Similarly, I want to thank you. I mean, it's not easy to be out there and share your story and talk about this, but it is so important to spreading the word and raising awareness and really encouraging young people to be mindful of symptoms that they're having and to get screened, when they reach screening age. So, what you're doing is so important.
Thank you for saying that. For our guests, we close with one question, so I'm going to ask you the same. And I'm curious, what does it mean to you to be seen?
Well, I would like to be seen for the impact that I've had on my patients and my family around me. And they say it's not your accomplishments or what you've done in your lifetime that is remembered, but how you made people feel. And so I really focus on that and just try to make sure I help everyone I can around me.
Oh, I love that. I love that. The impact that we can make on each other is so powerful. And I'll carry that with me. That's really, really special and important. So thank you for sharing with us today. Thank you for supporting this cause and for continuing the perseverance that you have against something that is so challenging to navigate and understand. And I'm here for the day when we see that curve reverse and or flatten, and the celebration's going to be good when we get there.
Agree. Thank you so much for having me.
My pleasure. I am so stinking grateful that Dr. Kimmie Ng and her team at the Dana-Farber Institute are making these resources available to anyone, regardless of being in the Boston area, because there simply are not enough centers like she has founded for those of us experiencing young-onset colorectal cancer. We've also added 2 Taylor Swift songs inspired by the music pumping through Dr. Ng's family these days. One is You Need to Calm Down. I mean, don't we all? And Wildest Dreams, because yes, it is in my wildest dreams that we reverse this curve and we are able to intervene earlier with listeners like you. So please share, reach out to me directly at Marisa Peters 777 on LinkedIn, follow From Carpools to Chemo, and connect with beseen.care on Instagram, TikTok, and all of the other outlets where you hang out. Thank you so much to Mike, my producer, for helping me work on my brevity, which is still a work in progress, and for making this show possible. So thank you for listening, and we'll see you next time. Thanks, everybody.